We do this in a stepwise fashion. Initially, we mark it so we know exactly where we're going to make our puncture wounds and which direction or which vector the threads are going to be placed. We numb these areas where we intend to first make the initial puncture, and then where the needles will come out at the ends of the skin. That's where most of the sensation is in the skin. There's very little sensation in the subcutaneous plane where we pass the needle, so we usually don't have to numb that area. And then we remove the thread from the package, and you can see the thread has little knots and little cones in it. We have to pull the thread taut in order to tighten those knots. That's just one step to make sure everything is as tight as possible, because if you don't do that, there'll be too much give in the thread. The thread then gets placed under the skin, and these little cones will hold the tissue, so it can only be pulled in one direction. It won't be pulled backwards. The nice thing about this technique versus some other threads that don't use cones is that it's a little more forgiving. So if you were to over pull it or over tighten it and you see a pucker, you actually can massage the cone free so it'll readjust tension wise. So you're not stuck with how tight it is if you over tighten it. That also decreases the risk of complication. After we place all the threads, and often we do this on both sides so we can take a look at the symmetry as we're making our adjustments, we can advance the thread and kind of push the tissue over the thread to bunch the tissue up. This gives the lift. And once we're happy with the symmetry and we have the same lift on both sides, we can trim the end of the thread that comes out of the skin off, and we're done. The lifted effect from the sutures lasts on an average of about 1.5 years. Now there's a variability there. It depends a little bit on how your tissue responds to the suture and whether you have some remodeling of the tissues, which is part of the process. The bare minimum would be 3 months because the sutures themselves last 3 months.